Good afternoon, everyone. Welcome to the official press conference of the Ministry of Health of the Republic of Indonesia, held today, Tuesday, May 19, 2026. This press conference is called as the government's official response to the rise of measles cases that has become a serious concern across our country. With us today are the Ministers of Health, Faras Adipashahira, epidemiologist and public health expert Nabila Ramadhani, Director of National Immunization Program Arya Saputra, and representative of the National Disaster Management Authority or BNPB, Mr. Ahmad Rizki Fauzan. We will start with opening statements from each speaker, followed by a question and answer session. Now I give the floor to the Ministers of Health.
Thank you, Ms. Rahma. As of mid-March 2026, we have recorded 58 outbreak events across 29 districts in 14 provinces. More than 19 lives has been lost, every single one are preventable. Today, we call on all Indonesians, please complete your immunizations. Vaccinations is fully all public health centers across Indonesia.
Thank you to Faras Adipashahira as the Ministers of Health for the explanation. Next speaker, Nabila Ramadhani as the epidemiologist.
Thank you, Minister. To better understand why this outbreak is spreading so quickly, it is important to understand how measles works. Measles spread extremely fast. One infected person can pass the virus to up to 80 others. It typically begins with fever, cough, runny nose, and a rash. But in severe cases, it can lead to pneumonia, seizure, or even death. To control the outbreak effectively, our response follows three key steps: detect, prevent, and respond. This means identify cases early, expanding vaccination coverage, and ensuring rapid, coordinates action at every level of the healthcare system.
Thank you to Nabila Ramadhani as the epidemiologist for the explanation. Next speaker, Arya Saputra as the Director of Immunization.
Thank you, Ms. Rasma. Thank you, Ms. Faras and Ms. Nabila. And this operate in several provinces remain dangerously low. Banten, for example, is at only 98%, far below the 19.5% needed for herd immunity. We have deployed additional vaccination teams, launched a catch-up immunization program, and secured vaccine suppliers. The MMR vaccine is certified by BPOM, meets WHO standard, and is completely free.
Thank you to Arya Saputra as the Director of Immunization for the explanation. Next to the last speaker, Ahmad Rizki Fauzan as the BNPB representative.
Okay, thank you. BNPB has identified serious logistical gaps in reaching remote and disaster-prone areas. Vaccine delivery has been delayed due to infrastructure limitation. We have mobilized emergency logistic teams and urged stronger coordination between central and regional agencies. So now community is left without access to vaccination.
Thank you to all our speakers for those important statements. We'll now open the floor for questions. Please go ahead.
Okay, so Minister, how did the situation get this bad before the government took stronger action?
Okay, yes, so we have to be honest here. After the pandemic, we didn't give enough attention to vaccination, right? And then we got so much focus on COVID-19 and routine immunizations was forgotten. That was our mistake, that is on us. So for now, we have declared that this is a national emergency, and then the funding emergency was released. And then the last thing is we are talking directly with 14 provinces that affected, every single day.
Okay, why are people still hesitant to vaccinate? What is being done?
Thank you for the question. So, vaccine hesitancy is often about trust, and disinformation. In recent years, vaccine usage and disinformation has spread widely through social media, creating fear and confusion among all communities. To address this, we work closely with trust community figures, including religious leaders, teachers, and local elders. We have also trained thousands of healthcare workers to engage in honest, respectful, and two-way conversation with families. Building trust is just as important as providing accurate information. Thank you.
What does the government use to control the outbreak?
Okay, thank you for the question. Within 30 days, we target 90% vaccination coverage in all active outbreak zones. Within 90 days is 70% reduction is in new case. Within 90 days, all active outbreak status listed we will publish weekly progress report. But the government cannot do this alone. Vaccination is a shared responsibility for yourself, your family, and everyone around you.
Thank you to all our speakers for the very informative response, and thank you to everyone for the important questions today. That concludes the official press conference of the Ministry of Health of the Republic of Indonesia. A full written statement including outbreak data by province and vaccination access information will be given to everyone before leaving the room. The Ministry of Health will hold follow-up press conference every 2 weeks until outbreak is fully under control. To all Indonesian people watching this press conference, please do not delay vaccination. Protect yourself, protect your family, and protect those around you. Thank you very much. Good afternoon.